The pelvic floor is the basin. It's the basket of your being. It's highly energized. It holds your organs up. It has a big, deep sexual function. It plays a part in stabilizing the pelvis, the lumbar spine. It also has a lymphatic function, right? So it is incorporated into almost every aspect of your life, and it's involved in all motions of the body. And it's also, responsible for beautiful orgasms and connections, and for women to really feel deeply intimate, the pelvic floor muscles have to be in good shape. Pelvic floor therapy is a relatively new field. When I had my daughter 15 years ago, I couldn't even find a pelvic floor therapy. I didn't even know what pelvic floor therapy was. And I say the day that I had my daughter was the day that I birthed my purpose, because I became a pelvic floor therapist. Because I knew intuitively that these were muscles. And when you're dealing with the muscle, you just treat it like any other muscle in the human body. You massage it, you exercise it, you do breath work with it, you do yoga, you incorporate different types of exercises to get the muscles to respond better, and you strengthen the muscles too, or sometimes you have to relax them. So pelvic floor therapy is an incredible field that is revolutionizing women's health care. And I think that all women, in other countries, by the way, women do see a pelvic floor therapist after they have a baby, but I think that it should be preventative care. All women should go see a pelvic floor therapist. All women should know how to massage their own vaginas, to do their own Kegels, reverse Kegels, and exercises. I mean, this is part of the self-care that we need to be doing. 30 million women in the U.S. suffer from pelvic floor pain, 1 out of 3. And it can express itself in so many different ways. It can be low back pain, it can be sciatica, it can be sacral pain, it can be pain with initial penetration, it can be pain with orgasm, it can be pain with sitting, because these muscles are so intimately connected with the upper and the lower extremity, it can affect multiple systems. After treating over 14,000 women, one thing that I can say for sure is that when women come to see me, they're at the end of their ropes. They have been struggling for years. The average woman sees about 5 to 7 doctors before she gets a proper diagnosis, which is absolutely insane. She's traveled from doctor to doctor. She comes to me and she is feeling like there's something wrong with her, like she's really broken. Like her marriage could be on the line. She may not be able to go to work. She can't sit. And she's really frustrated. And by the time she comes to me, she's like, you have to do something. And I'm like, yes, you're in the right place. Because this is something that can be treated with integrative therapy, right? And that's what the literature says too. We don't need numbing injections, we don't need, surgeries, and we don't need pills to solve pelvic pain. It's something that can be treated holistically and organically. When it comes to the pelvic floor, men have issues in this department too. When I started my practice, I thought I was just going to be seeing women, and all of a sudden I have 40% men. And I'm like, what is going on? So prostatectomy surgeries, a lot of men, that's typically more like a leaking issue, right? They're leaking when they're coughing, sneezing, or laughing, or just uncontrollable leaking after a prostatectomy. But many of the men that I saw was for pelvic pain. And with them, it was like a deep ache in the pelvis, erectile dysfunction, pain with sitting, frequent urination, pain with urination. It was making them nuts. And what I found is that these men have very tight pelvic floors. I think one of the most important things that women can do for themselves is exercise their pelvic floor muscles. Now, everybody wants to do Kegels, right? And Kegels is a contraction of the pelvic floor muscle. All the 4 walls of the muscles come in, but they also lift up. But Kegels are not for everyone. Some women who have pelvic pain should be doing something called a reverse Kegel. And a reverse Kegel is really simply breathing very deeply into the vagina and imagining that it's opening up and relaxing and blossoming like a rose in the springtime. So breath work is really important. And many women who suffer from pelvic floor dysfunction have paradoxical breathing, which means when they inhale, the belly flattens instead of expanding outward. So one of the critical things that I think is important is how are you breathing? And can you correct that faulty pattern? Because once you can correct that faulty pattern, then you can do Kegels and reverse Kegels the right way. Because Kegels you do with exhalation breath, and reverse Kegels you do with inhalation work. I also think that all women should be stretching their vaginas, just the same way we stretch our hamstrings. So simply putting a finger inside the vagina and pressing downward towards the floor, I think would be really, really important, because if the muscle's too tight, or if the muscle's too tight and too weak, or a combination of thereof, you need to bring back the flexibility of this muscle. And sometimes manual stretching is incredible, right? So you find someone who can teach you how to do that. There's a whole industry making money on women's backs. And I believe that when someone says, hey, do a mesh surgery, when someone says, hey, do a lifting for the bladder, when someone says, I'm going to inject something into your vagina, that is the moment. Or when someone says, I need to take your uterus out for a hysterectomy, that is the moment that you have to be like, okay, what is the informed consent here? What are my options? And get a second and third and fourth opinion, because sometimes pelvic floor dysfunction and pelvic pain can make a woman desperate. It's understandable. It can ruin your entire life. I've been there, I know it. And I've been through many of these procedures myself. But I didn't know. And I think when you know better, you do better. The truth is that 50% of older women suffer from pelvic organ prolapse. The truth is that 49% of women leak on themselves. The truth is that 1 out of 3 women suffer from chronic sexual pain. But it's not over. There's so many natural things that you can do to help yourself. All women should be listening to the cues of their body. All women should be paying attention to their posture. Really important. Don't push with urination and defecation. It really hurts the muscles. Drink water. Meditate. Movement is incredible for healing. And know that you're not alone, that you're actually in the majority. And that the moment that you realize that you're not alone, and the moment that you know how to care for yourself, that is the moment that you'll be free. And to always think about working with a group of individuals that can help you to be the best version of yourself. Right now, the responsibility of all practitioners, and this is my philosophy, is to awaken the doctor within you, to help you to connect to the information so that you know what you're taking, and then you yourself can make your own choice for your own well-being. The moment is now to take back what's ours, right? We can't outsource our care anymore.